of those issues?
Happy to, Governor. The only what the Orlando General was just saying is exactly spot on what we're saying. The only thing that I will tell you, about 12% of our admissions, 12% of our admissions are from vaccinated people. Half of that group are people that are coming in for other reasons than COVID. So we have about a quarter of our positive people. We have right now 280 patients that are COVID positive. A quarter of those are here for other purposes and are asymptomatic. And of course, when we test them, we find out that they have COVID, but they're not here for COVID, even though they are actually.
This summer versus last summer, I think you guys were in probably the 60s, and I think you told me it was about 47 for what you're seeing. Again, indication, I would imagine that those high vaccination rates with seniors have provided some protection. But you want to elaborate on that?
Yeah, sure. We the median age last year was right around 68 years old. The median age, after we spoke, I took a look at our numbers when I got into the hospital, and our median age right now is about 57. So it's about a 10-year swing. So we are definitely seeing a much younger population, which is an indication that the strategy that the state took and that the health system took, or health systems took, as it related to vaccinating the older population and the more vulnerable population in our state is absolutely working. What Orlando Health is experiencing, Tampa General is experiencing the same thing. We are absolutely seeing it's skewing younger. They are not as sick. And then the folks that are coming into the hospital that are vaccinated, this is a tricky one. A lot of times people look at this and say, oh, wow, there's a lot of vaccinated people getting hospitalized. What the public has to realize, the vast majority of those vaccinated individuals, this is our experience, and I'm assuming this is probably the experience of most institutions, the vast majority of those vaccinated individuals are folks that are immunosuppressed already. So we have a lot of transplant patients, a lot of cancer patients that are vaccinated, got COVID, and have ended up at our hospital because they're immunosuppressed anyway. And the vaccine that they got originally had an effect, but didn't have the effect that the vaccine had on other people that weren't immunosuppressed. So the vast majority of our vaccinated patients that are really critically ill are those that already have underlying severe illness. And that's important for the public to understand because that's what's happening on the ground. So when you look at our experience right now, it's definitely skewing younger for sure.
And you're seeing a reduction year over year in mortality as a result of not having as many elderly patients?
No question about it. Yes, sir.
Shane Strum down in Broward, you obviously were up here in Tallahassee when we were working, and as Carlos said, I mean, I think probably maybe not 50%, but pretty much a strong plurality of all the hospitalizations were in those three counties, Dade, Broward, and Palm Beach. Are you seeing the same? Carlos has seen, increases, but not at the level that you guys saw last summer?
Yeah, you're correct. The patient volumes are definitely moving in that direction, but they're not where they were last summer. Last summer, you saw the surge really in South Florida. Now you're seeing it statewide. I would say our numbers are comparable to the other major healthcare systems out there. 95% of our current patients that are here are unvaccinated, but you heard John Corus a moment ago talking about that average age. Ours was in the low 70s last time. This time it's in the 50s, low 50s, so you see a big difference there. I think another critical or important number to share with you would be that 80% of our patient census is non-COVID patients. These are critically ill patients, many of whom delayed care during the pandemic. In fact, we pleaded over the last 6-7 months for patients to come back. Don't miss your diet, don't miss your patient meetings, don't miss with the physicians. And as a result, they've come back here. So only 20% of the patients we're seeing at this time are COVID. Pediatrics. Go ahead.
What are your doctors saying about this Delta variant? It seems to be more contagious. But then we're seeing the case fatality rates much, much lower than we saw last summer, for example. So how are they viewing this Delta variant compared to maybe what they were facing last summer?
Want me to jump on that, or Dr.
Yep,
Rawls?
yep.
Okay. Sure, I'm happy to answer it. So our physicians, clinicians, and others have been talking about this variant is much different in that they believe it spreads more aerosolized, whereas the last one wasn't so much. But the nice thing is they've shown that the strain is less, so it might be more infectious, but it definitely isn't keeping the patients in there. I'll give you great statistics. So those who have been vaccinated that come in are typically over 70 here, even if the average age is in the 50s. But what we're really seeing is their length of stay, the vaccinated, is about a day or two. Those who are unvaccinated, we're seeing about 5 to 7 days. But something we're also doing that you encourage and a lot of the others where we work with ACA, the Department of Health, are the monoclonal antibodies. So they're coming in, they're able to get those, and we're seeing our patients, they come in for an infusion, it lasts about an hour, we watch them for another hour, and then we're able to discharge them. But overall, you're seeing more people because it's more contagious, what our physicians are telling us, but it is less powerful. So the length of stay the patient is staying here with us is less.
Lenny Curry up in Northeast Florida. I know you've been working with all of your hospitals there. Last summer, as Carlos and the folks in Broward and other South Florida were seeing, I mean, obviously you guys saw an increase in COVID patients, but it wasn't as acute of a spike as they saw in South Florida. Now this summer, you guys saw a more dramatic increase in hospital admissions. So what's the lay of the land up in Northeast Florida in terms of the hospitals and how things are going? I don't got him. You may be muted. Wait. No.
He's not muted.
Are you there? Yeah, we're not hearing him.
Oh, he is muted. He is muted, Governor.
He's muted.
Yeah.
Is it unmuted now?
technology.
There we go. Okay,
Right.
we hear you now. So
Sorry
start
about
from the top.
Sorry about that. Good
Yep.
morning. Good morning, Governor. Thanks for your leadership on this issue over the last year and a half, and appreciate you putting this important discussion together. Our hospitals are incredibly busy. You're right. I speak with the leaders of those organizations regularly. Doctors, nurses, administrators are working hard. But the message that I have is that 99% of those COVID patients are not vaccinated. There's a lot of discussion. A lot of people are afraid and panicking. From my perspective, this solution is get vaccinated. I'm not suggesting we coerce or force or mandate people to get vaccinated, but we keep working together to educate them that the vaccine is effective. It will keep you out of the hospital, and it will keep you from getting really, really sick.
And John Corus, Shane Strum had mentioned the monoclonal antibodies. Can you talk about how that landscape has changed? When we first came out, I remember I had a discussion with you. I said, hey, do you need us to set up stuff? And you're like, no, we got it. And so you guys I know you guys had been dealing with Regeneron even before the EUA, but you guys really leaned into it. At the time, it was for non-hospitalized 65 and up, and they've now since expanded the criteria. So can you just give an overview of kind of the lay of the land on that? Because, we hear a lot about, obviously the vaccines. We hear a lot about non-pharmaceutical interventions, whether it's restrictions or masks or all this. We really don't hear as much, at least publicly, about if you do get infected, what are your options? And these monoclonals, I know you and I talked about, have had a really good track record. I think there's good data on it, but I can tell you anecdotally, I don't think I've ever talked to anyone who wasn't happy that they did it. So can you give us an overview, and then who would be eligible to do a monoclonal antibody?
Sure. Yeah, absolutely. Thank you for the question, Governor. So Tampa General Hospital and the University of South Florida have been collaborating for almost from the beginning of the pandemic with Regeneron and other organizations related to monoclonal antibodies. And I will tell you, from our perspective, both anecdotally and from a scientific perspective, they work. And at the beginning, it was very restrictive. You're right. There was a very tight criteria on who could use these therapies. Right now, if a treating physician determines that a patient who currently has tested positive for COVID can benefit from the therapy, they're able to get the therapy. It's as simple as that. And actually, we've been encouraging the medical community in our region to aggressively look at this as an approach to treating COVID. Because it's very effective. We just published a paper on this with real data, real science behind it. And you're absolutely right. Anecdotally, almost 100% of our patients have told us that 24 to 48 hours later, they feel much better and symptoms start to subside. We currently we're doing 35 to 40 treatments a day. Right now in an outpatient clinic on our campus. The FDA and Regeneron specifically just expanded the use to actually start to use it prophylactically for a certain type of patient that's high risk, that might be exposed to a COVID positive patient. They now have access to the therapy for prophylactic use if they want it. And we're really encouraging people to take advantage of the therapy because Shane's right. It's an hour-long treatment. You spend about another hour being monitored. And for us, it's about 2.5 to 3 hours in total that the patient is with us. And then they go home, they quarantine. And like I said, 24 to 48 hours later, they really start to feel better. And I would encourage people to use it. We have had great success, and we've actually expanded our clinic to 7 days a week, 12 hours per day. And we now have 15 chairs that we have access to. So we're increasing the capacity of this of our ability to do more of this therapy.
Now, your physicians or our physicians who would refer people to your clinic, would that be if they did it prophylactically? If someone's already vaccinated, would they still potentially be a candidate if they are especially high risk?
You absolutely can do it. We are treating people that are not vaccinated, and we are treating people that have had breakthroughs. As rare as breakthroughs are, we're treating those people as well.
But are you doing that on a prophylactic basis too? Like if someone's vaccinated and they wanted a prophylactic treatment, or would that just be for people who are not vaccinated?
No. If they test positive, so if they're vaccinated, they get exposed to COVID, they test positive for COVID, they can access the treatment.
Okay, but not on a prophylactic basis prior to infection.
Only if they meet a criteria that was just recently opened up. So there is a very specific criteria that Regeneron and the FDA have just allowed hospitals to start using, vaccinated or unvaccinated.
Okay, so that doesn't matter. Yeah, okay. That's I just think people want to be clear on that.
Governor,
yes.
So you know, like John, we're a very large transplant program, actually the largest in the country today. And we started prophylactically with John's comment to do it to all transplant patients. That is a family group that it definitely is in the profile of the immunosuppressed environment. And we're prophylactically doing those patients and seeing a big result on that. So different, we provide the monoclonal antibodies through our EDs 24 hours a day, aggressively doing it. But that family specifically is one of the transplant patients are the ones that are getting it prophylactically before they even have COVID. And we've only been doing it for 10 days, but that's part of the agreement with the FDA. And it's actually working out very well.
And now are you doing the Regeneron and the Lilly, or one or the other, Carlos?
That's above my pay grade. That's somebody else's figuring that out. All I can tell you is we're doing the monoclonals.
Okay. Yeah. No, it's good stuff. And so just like Shane, you had mentioned, you guys are doing it. What is the advice to people about when they should seek it? Because, you know, this is the type of thing, I think the results have been really, really good if you get it early. But if this, if the COVID-19 progresses to a certain point, then doing the monoclonal late in the stage, I think the results, haven't been as good. So if someone's just out there right now and they get infected, what should they do in terms of accessing this?
They should immediately go to their primary physician, or they could come to our ER where we're taking people in. Like John Corse mentioned, we've set up additional rooms and bays where we can bring people in right away. What was happening in the past is you had to meet with your primary physician. Then they would have to write a script for you to be able to get the monoclonals. What we're doing now is when you present, we're writing it, and then we're asking you to stay with us. We have 24 to 36 bays, as I mentioned, that are set up. You want to do it immediately. The best results that we're seeing is those that test positive and come to us right away. Not only does it work well, but it actually not only keeps them out of the hospital, but they're recovering a lot faster. And it doesn't matter on the age. We've seen whether you're 40 to 70, the monoclonals have been working. But the important thing and the key that you said is immediately getting into the hospital and sitting through the process, getting the infusion.
Governor, yep.
Governor, I'm just to add to what Shane said, I'm told by our clinicians and the research we look at is the window for this is sort of 5 to 7 days of onset of symptoms, or when you test positive for COVID is typically what we've been looking at. This therapy is not for late stage COVID symptoms. I mean, it's really not. It is designed for ambulatory it's an ambulatory therapy, and it's designed to catch it early in the disease progression, not later in the disease progression. So we encourage our physicians, our community, folks that have COVID to get on top of this quickly so they can take advantage of the therapy.
And Orlando Health, either Dr. Rawls or David, how are you guys employing the monoclonals?
Yes, sir. So we are actually not doing this in our EDs at the moment because of the inpatient and ED volumes really requiring us to use all of that space for acute care at the moment. We do have monoclonal antibody therapy aligned through some of our home health agencies and outpatient clinics. So it's something that we, as has been mentioned, encourage to those folks that are not sick enough to come to the hospital, but certainly early enough in their disease to benefit from it. So organizing that in concert with some of our outpatient resources, but we absolutely do have a lot of people in the community that ask about it. We have a lot of providers in the community that refer patients to the ED for more information on it.
And Mayor Curry, what is your sense, with the public up in Northeast Florida? Are these monoclonals? Is it something that most people are aware of? Because again, my sense is, this is something that we were working on last year when we got in and worked with the hospitals. And I think the results from the beginning were always very positive, but it's just not something I think you hear as much about publicly as some of the other things that are typically talked about. So what's your sense on that? And would it be helpful to do a little bit more public messaging about these being available so that people realize if you act quickly, it can really make a difference?
Yeah, Governor, I don't think people are very much aware of it, to your point, and I think some messaging would be helpful. In fact, as this discussion was happening, all of my staff that are in the room with me, there's about 5 of us, everybody was shaking their head and listening and learned something new today. So I think we should get that message out.
Okay, yeah, we'll be working on, I think we're going to work on that. I talked to John about highlighting some of the great work that's going on, because I do think it's really made a difference. And I think if people know, that that's out there, I think it'll be something that will be good. So David and Orlando Health, what do you guys, I know you guys have had, I think, some of the most accurate models in terms of when you're reaching peak. So where do you guys think you are right now in this wave in terms of your hospital census?
It appears, Governor, that we have, we hope, we've plateaued as far as the peak. We've hovered across our system in the 500 positive inpatients for the last week or so. And we hope what we're looking at, if you look at the models in the UK as well as the Netherlands, this peak went up very rapid and then fell very quickly. So we're hoping that same thing occurs here. Right now, I think important, similar to what Shane talked about, across our system today, we'll do over 13,000 patient encounters. Less than 5% of those encounters will be related to COVID. And so the important work that our team members and our physicians do every day continues, even with this COVID peak. And so we are at the place where our team knows how to take care of COVID patients well. But we want to make sure that we're continuing the work that we're called to do every day. And so I don't want folks to lose sight of that. One of the things that occurred, and you've heard some of my colleagues talk about it this last year, where people delayed care, that creates significant issues. And unfortunately, many people are paying for that today. So we would just encourage people not to delay care, but seek the care that you need.
And I think, would anyone disagree? Sometimes people will put out stuff on like social media, say, oh, Tampa General, they have no ability to see anybody or this or that. And even at height of COVID, you guys have massive health systems. The COVID patients are a small fraction of the overall beds that you're doing. And so if somebody has heart, stroke, any of these things, they need to be going into your hospitals. They will absolutely be treated. Is that 100% across the board from all you guys?
Yeah, so Governor, this is John. Right now at TG, the short answer is yes. If you're having a heart attack, if you're having stroke symptoms, if you're having an emergency, a real emergency, go to your emergency room. I probably speak for every institution. We're open, we're here, do not wait. I think David said it really well. Do not delay care. the hospitals are ready and we're able to take care of patients in a crisis and in an emergency. At TGH right now, we have 126 COVID patients. We're a 1,041 bed hospital. That's a little over 10% of our beds are devoted right now to COVID patients. There's no question, Governor, that our ERs are full and we are busy, that we have the most COVID patients that we've ever had through the pandemic, but we are a large hospital. We have great teams of physicians and nurses and respiratory therapists, all trained and focused on our COVID patients as well as our non-COVID patients. Our elective schedules are open and we're operating. But we're watching all of this hour by hour. And if we believe that we get into a position that's unsafe, we'll start to slow things down and we'll start to move things around. But people cannot delay care. They need to come to their hospitals if they are sick and if they are having an emergency.
And you guys have been doing this now for a year and a half. I know initially in March and April 2020, there were people who feared. Some people thought the hospitals were all full of COVID patients, and some thought, well, if I go to the hospital, maybe I'll catch COVID there, and that would be like kind of an unsafe environment. But to the contrary, I think you guys have all done so much to where the hospital is probably one of the safest places to be if you're looking not to get COVID, correct?
That is exactly correct, Governor. And to add to John's point, we are 21%, which is similar to Shane on a number of COVID patients that we have. At our peak last summer, we were at 49% of our census. So we're dramatically lower. And not to add to our volumes in the EDs, because obviously we're all very busy, but John's point about coming early is extremely important. The only real impact that we have to COVID, aside of vaccination, from a prophylactic perspective, is that monoclonal antibodies. And you can only do it in the first 7 days. So, and many people, unfortunately, are waiting till they're really extremely sick. And at that point, it's too late. We can't do that for them. And then we're just dealing with the symptoms they have and not with the COVID. The only real impact we have from an ambulatory perspective on COVID is the monoclonal antibodies. So getting to us quicker is the only way to really fight those people once they're sick and have symptoms. So the two messages here are really, obviously, vaccinated people have a lot less potential of getting hospitalized. That's extremely important. And if you get sick, go see someone in the first 7 days. Monitor your oxygenation rate. There's machines nowadays you can put in your finger. You know, if your number is down below 94%, that's a problem. And go to your ED. And we will look at the criteria. And if we can, and we're a lot more liberal about it today, is provide the monoclonal antibodies. Extremely critical to prevent this from getting any worse.
Yeah, I think one of the theme that we're hearing is there's not enough information out there about the monoclonal. So we've got to do a better job in educating the public. That window of time is really short. Once you realize you've got to get in there, most of the hospitals have ramped up now. So we're seeing in the physicians writing the script and they're bringing you back in. Our hospital's taking the extra step to make sure that our auditoriums or conference room that's where they're housing you. You've talked about the concern about COVID patients. The hospitals are safe. Our 20% census is the COVID, but they're in different areas, negative pressure rooms, so we're keeping an eye on that. So you've got that along with, really overall educating the public is a key to concern, making sure that they know that we've got the playbook. We've been here before. Our front line, our doctors, our physicians, our clinicians, the nurses, they're tired, but they're heroes. They've worked hard every day. They're not going to let anyone down. They show up every day with a purpose and a sense of mission, and we're taking care of both coins. Those that are sick and need to be here because they've delayed it, and those that are in here because of COVID. But we've got the playbook.
You guys also, Shane, Carlos said, because, when there's a time of high prevalence in one of these waves, you guys obviously test everyone that comes in. So your COVID patients some are being treated and then some are incidental who are being treated for other ailments, but you still have to classify them as COVID positive and use negative pressure and all that.
That's correct. Right. Because somebody that would come in normally that maybe wouldn't, a kid falls off his bicycle, might have a sprain and some scratches and cuts. So we clean them up and get them out. They're now required to get the COVID test positive. They're there, and that would be for anyone or any emergency.
Carlos Magoya, this is not necessarily just related to COVID, but I know you guys are such a big system. I know all the hospitals, how the staffing situation is evolving. It was incredible because there was such a crunch for people last year, and I think it's kind of changing the way the industries run, where you could have a nurse who's working for a hospital, and then they could actually get hired by some staffing agency for more, and then end up basically doing the same job. So you just talk about how what those dynamics are right now and how that's affecting the hospitals.
That is a huge challenge that we have right now, Governor. We're seeing a lot of our nurses taking those temp jobs and going around the country where they're getting 2 or 3 times what they get paid. And that's putting a challenge on what we're doing. So from that perspective, as Shane is talking about our people being tired, it is a challenge. Not only we've been at this for 18 months, but many of the people are working overtime to maintain those ratios. And we're bringing in new people. We're working also with the schools, by the way, longer term, to make sure we accept as many people as possible in the nursing schools, because there's a lot of people that want to be in the healthcare side. That's a longer term answer. In the meantime, we do have challenges right now from a staffing perspective, as some of these people are going out there and getting the short term jobs. And that's why I spoke to you and I spoke to the secretary about the fact that some of the other states are aggressively going after our people and doing that. And all we're doing is really stressing different. Last year, when you helped us out with that, we were doing it in urban environments only. So therefore, it wasn't as big a need. Now the entire country is in this situation. So if we're pushing from one side to another, we're just putting pressure on staffing throughout the country. And that's a real big challenge right now that we're dealing with. And the only thing we can hope for is that this surge that we got going on, it really peaks out of here pretty soon, and then we get back to a more normal environment. But that is a challenge, and we're all dealing with it.
Secretary Marsteller, can you just talk about? I know you've been working with all the hospitals throughout the state. What are some of the things that you've been working on with them?
Thank you very much, Governor, and thanks to everyone who's on the call. I, from my perspective, am grateful for and very impressed by the way the hospitals and all the facilities across our healthcare system have once again come together to deal with this. I appreciate that we have open communication. I think everybody on this call has my mobile number should you need to call me about anything. But several of the things we are doing, and I want to just remind everyone, from a capacity perspective, from a bed capacity perspective, all of the flexibilities that the hospitals have had throughout this COVID time, those flexibilities still exist. And so if anyone needs to expand outside of the areas in which you have licensed beds, you all have the flexibilities to do that. All we need is to know, and that's simply pick up the phone and call either me or one of our field offices or my deputy secretary, Kim Smoke, whose phone number I do believe everyone has. Another thing that we have been doing to help with capacity issues, we have been working with our Medicaid health plans to expedite prior authorizations. And in fact, 4 of our plans on interfacility transfers, 4 of our plans have reinstituted waiving PAs for such transfers, and those companies are Aetna, Humana, Simply, and United. We continue to have conversations with the remainder of our plans, but I will say if there are any particular situations in which we at ACA can intervene or I can intervene to help move things along, we will do that, and we have been doing that. My staff is working around the clock to make those calls. We are expediting as well and prioritizing any background checks that you all need to have as you bring staff in. All we need to know is who they are and where you need them, and we will expedite those background checks as quickly as possible. And finally, I am moving around the state. I have been on the phone with our rural hospitals to check on them. They are weathering the storm pretty well. As they have equipment needs or any other needs, they can contact, and anybody can, your county emergency department. Governor, your Division of Emergency Management is handling those requests as they come in and moving equipment and supplies out to where it's needed very quickly. We are working with everyone, and I just want you all to know that I and my team are going to continue to be here 24 hours a day. Again, you all have my number. Governor, I do just want to say that the seniors first approach that you took to vaccination, I am seeing the results of that in our long-term care facilities. I spoke to an administrator of an ALF in Jacksonville over the weekend who confirmed that the cases that he is seeing right now are few and that symptoms among the residents are relatively mild. Of course, they're also dealing with trying to encourage their staff to become vaccinated, but this conversation that we've had today, I think, has been very helpful to all of us. So I thank you for that.
Great. Mayor Curry, you need anything up in Northeast Florida?
Just, Governor, I appreciate just continuing the message to educate people that the vaccines are effective. If you have a concern about a vaccine, get with your healthcare provider. Look at the information. My family's vaccinated. That's a choice we made. I think it was the right choice. Our hospitals simply would not be busy and full. The data suggests if more people were vaccinated.
Great. And, we've had, I think according to CDC data, we're over 91% of seniors have gotten at least one shot in the state of Florida. And we're close to 80% of all 50 and above who have been vaccinated. And obviously some of those have recovered from COVID. And so there would be probably well over 80% that would have some form of protection. So I think that is really the name of the game, and people can look to see who's got that vulnerability. And I think the testimony here today about the efficacy of these monoclonals, very encouraging. And then the fact that the folks, the elderly population who did do the protection, that's paying off. You may test positive. You just got to be honest with that. Maybe it's a reduced chance of testing positive, but people are testing positive. It's mostly mild cases. But I think that we just, some have said if you get vaccinated, you will not get COVID. And then that's not accurate messaging. So we always want to be accurate with it. You may test positive. It may be something that you end up getting infected with, even if you're vaccinated. But I think every single hospital system is saying the same thing, that population that did do that, who is especially vulnerable to COVID, is benefiting from protection against severe illness and against mortality. So it's really important. And I just want to thank you guys for what you've done, not only now, but really the whole time. At first, we didn't kind of know what we were dealing with back in March of 2020. And then it just got to the point, anytime new things were coming out, whether we ramped up the testing, whether we did the monoclonals, other types of therapeutics, the vaccines, you guys had a huge role in really leading the state through all those different stages. And so, I hopefully, with what David said about Orlando, hopefully we see the plateauing across the state. That would be really good. But I think, I'm just encouraged about the good work that y'all have done. So thanks for taking the time. I think this was informative, and I think this will provide the citizens of Florida with a lot of good information. So thank you guys.
Thank you, Governor.
Thank you, Governor.
Thank you, Governor.
Thank you, sir.
Okay.